Hello, good morning, good afternoon, good evening. How is your day going? Okay, my name is Peace Augustus Dinkma, registered nurse from my home country and UK registered mental health nurse. And what do I do here? I come here to give you, to teach, to coach, to give you tips on how you're going to pass your international nursing exams. And guess what? We are in the series for mental health OSCE exams. Wow! Yes, it has started. Like it has started. So if you know anyone who is preparing for their mental health OSCE exam, please tell them not to miss any of the posts that I'll be doing this period. So after this video, this kind of video that I'll be doing now, it will be coming with practical videos for you to see how to do these exams, right? So, and before we start, please, if this is the kind of video that you would like to watch, if this is the kind of thing, thing that you need, please subscribe. Please subscribe, please like this video and subscribe to this YouTube channel. Okay, all right, thank you. So let's continue, and we are starting off today with the assessment. And I don't want to bore you with long talk. If at the end of the video you have any concern, any question, please feel free to leave it in the comment section. Feel free to leave it in the comment section. And if you know anybody, you're in a group, anybody that needs to watch this video or follow through, that the exam is upcoming, please, you'll be doing that person a favor by sharing this video to that person. Okay, so like I said, we'll be starting off with the mental health OSCE and the assessment station. So this is an intro, and then the next will be the practical video that I'll be sending here. Okay, so what is mental health assessment? That is for the mental health. Now, what is this assessment station that I've been hearing about? So assessment station is one of the four first stations, which is the API. I would also like to state that sometimes you might not get this assessment as your first station during the exam period. So I've had people who tell me that no space, they got so station instead first, and this station first. In fact, everything that I'll be sharing here is more of experience, both personal experience as someone who has gone through this process, and the fact that I've been able to coach people as well go through this process. So you should actually be very assured that you'll be getting the right information here. So why do I say this? Because there are some people that they get their mind at the thing, and if it is not like that, they come to the exam and they are not starting with a particular station that they know that they are supposed to start with. They get all disorganized, and before you know, they forget. Okay, so assessment station. While we know it as the first in API, you might be seeing IM first. You might see nutritional assessment. You might see what's it called now, even the PV or the EVP stations first. But we'll be explaining this as we continue. Okay, so assessment is the first of the API station. This station takes 20 minutes, but I am expecting you, of course, to finish before the 20 minutes. What else is in this assessment? In this assessment station, you'll be provided with question papers. I'll be sharing each and every one of them here on the screen. You'll be provided with the questionnaire, the overview, and the candidate notes. Now, for assessment, you might either get an assessment for depression or assessment for mania patient. Okay, when you have assessment for mania patient, these first three that I mentioned are the ones that you're going to get: the overview, your scenario, which is also like a second, the overview, and then your candidate note. Okay, but if you have depression, you're going to also have your PHQ-9, your PHQ-9, right? You would also have that together with this other script that I've mentioned right now. Okay, so they give you this, you read through, and then you begin, you're now expected to assess the patient based on this information, the information that are in your scenario. All right, so in this scenario, you're most likely going to see things like the presenting complaint, which has maybe the intro, where the patient is coming from, who brought in the patient, are you going to see this patient in their home, how has the patient condition be, like being a presenting complaint of the patient as at today. How is the patient as at when you're seeing the patient, what has happened, like a summary, a small summary. All right, and then after this you will then see uh the medical history, the past medical history. This has the information about the patient's medical history. For instance, you might see, say the patient is hypertensive, the patient had this condition before, the patient has been depressed, or the patient has mania, just as you're seeing now on the screen. Okay, so there would also be a social history, the patient's social history. What happens here? You have every information of the patient's loved ones. Does the patient likes to go out? Does the patient have dependents? What is their living situation like? And all that is in the social history. And the drug history, what medication is the patient taking currently as of today? What is the patient taking? And then you have allergy. So these are the things that are in the patient's overview that you're going to read, that you're going to scan through before you start the assessment. All right. So when I share the practical video of this assessment, you would even understand better. Okay. So now, if the patient is a depressed patient, that is when you also have your PHQ-9. You're going to ask the patient questions, ask them certain questions based on what you have. They also give you feedback based on what is there. Now, what are the things that you must do within this period? Try to ensure that you meet up to what is expected of you. We are mental health nurses. So you're going to communicate with empathy. You're going to try to reflect, to paraphrase what the patient is saying to you. I want to hear you say, oh, you said this, that. Okay. How about this? You're not asking the next question. You're paraphrasing the information that that person has told you. I don't want to see you introducing new ideas that is far from what is there. I want to see you using the person's strength. For instance, they might have relatives. You want to find out what is the support system like. That is the person's strength. They might have hobbies, they might have things that they like to do. This is the person's strength that would help this person to recover. On the other hand, they might also have weaknesses, um things that make their causes their condition to deteriorate even further, right? For instance, they might be smoking, they might be drinking, they might not be taking care of their self, you see. So now we want to help their weakness using their strength. So when doing assessment, another thing you must also note is that it is not like you don't have a static way that this is what I'm saying, this is the response, the way I want my response to be from my patient. No, I tell you, you might have one scenario, but everybody is going to act differently to that same scenario. So what are you then going to do? What are you going to do? So while assessing your patient, be open. Be open. Don't have a particular idea, and when it doesn't work the way you want it, it becomes a challenge for you to assess this patient. Okay. Now, another thing that is also of that is very, very important that I must say is checking for self-harm. It is very, very important. Remember that we are mental illnesses. So always assure that you assess if the patient has self-harm tendencies or suicidal tendencies. And then if they have, what is the plan? Could they have a plan? Would they want to share this plan with you? Explore further. Explore further with this patient. Always ask if they are willing to bring in their family members or friends into their care. Because of course you don't want to, go without the person consenting to having their loved one or whoever into their care, into being part of their care. So you ask them these questions, they give you the response, and then you conclude by identifying the problems that this patient is having. In fact, this is one thing I just dealt with this morning. Please prioritize your care, but that will be during planning. When we're discussing planning, try to prioritize. Okay, so identify the problems that this patient is having. Is this person having self-harm issues? Are they having low mood, but maybe they're not self-harm yet? This patient, is he having self-care deficit? This patient, is he finding it difficult? Is he having risks for malnutrition? Is he even malnourished already? Is this person's physical condition deteriorating? Right, you identify the problems. Is this person sleeping well at all? Right, identify the problems that this person is having to the patient. You tell the patient based on the assessment. And mind you, remember that we are using the recovery model of care in assessing our patients, right? So you identify this problem, share this problem with the patient, and then based on your assessment, you now tell the patient if you would want them to be in the hospital, or if based on your assessment they have the capacity to be better, like to improve in the community. Now I would also want to clear this, that sometimes we're like our patients should be in the hospital, but remember we are using the least restrictive model of care. If the patient presents in such a way that they are able to recover with good support system from home or the community, and then you are forcing these patients to be in the hospital, you know that that's a big fail, right? So you try to, based on your assessment, know what is best suitable for this patient. Now, another thing I would want to quickly talk about is the candidate notes. Now, everything that I've said, you can, use the patient, the overview there to, ask these questions. And of course, you can also use the candidate notes. Anyone that works for you will practice, you will say what is best suitable for you. Do you want to use the candidate note to ask about these questions, or do you just want to use the overview? And then during your assessment as well, please note down. You might forget. If there's things that this patient says that are peculiar to this patient, you can write them on the candidate note. During your evaluation, it would definitely come to play. It will help you during that time. So pen down anything that you find that is important or peculiar to this patient on the candidate note there. Pen it down, write it down there. Okay, and then you will come back to it later. So you've told this patient what you've given, you've recommended maybe that the patient can stay in the community or the patient can be in the hospital to recuperate, then they can now go back to the community. And meanwhile, I also share this that, say for instance, they have this support system, but presently this support system is not giving them the care that they need. Remember, they were even going down there in the community. So would it also be better that you take care of this patient in the hospital, involve the patient relative in the care, guide them on what to do before sending them back to the community? So these are the things to look at. You recommend the best suitable care for the patient, and then you ask if the patient has any questions. Ask if they have any questions. If they don't have, ensure their safety. If the patient is having suicidal ideation or self-harm tendencies, then that means you have to ensure that somebody is there with them or you are there with them. You can place calls for any other thing that you want to do. Always ensure the patient's safety and your safety, right? And voila, we are done with the assessment station. So that's practically it, as in explaining the assessment station. If you have any question, like I say, please drop it in the comment section rather below, and tell me where you are watching this video from. I want this video to um I want it to go viral. I want it to reach out to as much nurses as it can, because my core duty is to ensure, is to get you to pass your exams, is to get you to excel in this exam, is to get you to go sit for that exam once and make it once and for all. All right, then I will see you in the practical station. Like, I'm posting that soon. I love you and bye bye.